the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Pi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, decision-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Orasyo Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas ng mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang pagkalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ang mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Tumudulog kami sa iyong patnubay, mahal na Ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is Teenage Pregnancy, Nene is Now a Mother, or Murang Edad ng Pagbubuntis, Nanay na si Nene. Today's forum aims to give us an overview on health concerns associated to pregnancy in the teenage population. For today's forum, we have Dr. Gladdy Maura Facun, one of the authors of OB-GYN Pearls, a fellow of the Philippine Obstetrical and Gynecological Society, a diplomat of the Society of Gynecologic Oncologists of the Philippines, a member of the UPMA's Board of Directors, and an active specialist in various medical institutions in Region 1 as our moderator.
Hi, a pleasant So this event is brought to you by the Mu Sigma Phi Medical Sorority, the Mu Sigma Phi Foundation, the UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum is a series of panel discussions that aims to discuss common concerns of women from all ages and walks of life. This webinar series started way back in July of 2021, and today we are on our last leg of this year-round webinar series. Teenage pregnancy, Nene is now a mother. Murang edad ng pagbubuntis, nanay na si Nene. So for any of your questions for our speakers later, you may type them into the Q&A boxes of UP Manila Livestream and Zoom, or the chat boxes of Facebook Live and YouTube. Today's forum will focus on pregnancy among the teenage population. Nene is now a mother, so we will be acquainted with the prevalence of teenage pregnancy in the country, its potential complications, and of course, the measures in ensuring safety of both our young mothers and their newborns. So let's start. To formally start our forum, I am honored to introduce our speakers. Here with us today are respected and well-known specialists in their respective fields. For our first speaker, we have Dr. Maria Emma Llanto. Dr. Llanto is an esteemed alumna of the Cebu Institute of Medicine class of 1980. Currently, she serves as the chief of the Division of Adolescent Medicine in the Philippine General Hospital. She is the president of the Philippine Society of Adolescent Medicine Specialists. Dr. Llanto is also the co-founder of the Comprehensive Adolescent Pregnancy Program, or Teen Mom Program, and Healthcare Transition Program for Adolescents with Chronic Illnesses, Lipat Kalinga of the Philippine General Hospital. Dr. Llanto has also made several programs associated with adolescents in the Philippine General Hospital. She is the former president of the Society of Adolescent Medicine of the Philippines and a retired professor of UP College of Medicine. So everyone, let's all welcome Dr. Maria Emma A. Llanto.
Good day, I am Dr. Emma Llanto, and I will talk about an urgent issue, adolescent pregnancy. These are the objectives of my talk, and these are my main references. Every day, 500 babies are born to teenagers. So every day, the lives of 500 babies, 500 young girls, and 500 families will change forever. In the Philippines, 47 infants are born for every 1,000 girls aged 15 to 19. This is among the highest in the region. The average rate for the ASEAN region is 33, while the global average is 44. The NDHS reports that about 10% of all girls have begun childbearing. Higher in the rural areas, 10% versus 7% in the urban areas. Higher in those with less education and in those who live in poverty. This map shows the regions with the highest rates of teen pregnancy: Calabarzon, Central Visayas, Northern Mindanao, and Davao region. Now let's look at the trends in teen pregnancy. Between the year 2000 to 2010, there was a significant 65% increase of teenage pregnancy among those aged, especially among those aged 17 to 19 years. There has been a slight decrease as recorded by the Philippine Statistics Authority in 2019. However, what's alarming is that there is an increase in the number of babies born to girls aged 10 to 14, from 755 to 2,411 in 2019, or triple the number. As a rule, the younger the mother, the more complications for both mother and her child. Another disturbing trend is that 71% of babies were fathered by males 20 years and older. The older the partner, the higher the rates of coercion and abuse. We always ask for the age of the partner and screen for abuse during our interviews. Now, what are the risk factors for teen pregnancy? Early dating, especially with an older partner, who is defined as somebody who is 4 years or older, predisposes to early sexual activity. About 78% of Filipino youth who are sexually active do not use condoms or any contraceptive methods. Other factors are the lack of comprehensive sexuality education, as well as a general lack of discussion about sexuality between parents and their children. It's like taboo. There is a lack of health services for adolescents, including reproductive health services. There's stigma attached to accessing reproductive health services, and there are laws that restrict access to these services. For example, adolescents need parental consent to access contraception. The socio-ecological model shows that many factors can lead to teen pregnancy. So let's not lay the blame on pregnant girls. They're not hypersexed. Instead, consider the bigger picture and remember this model. Early childbearing has dire consequences for both the adolescent and her child. Again, the younger the adolescent, the greater the risks. Pregnant adolescents are more prone to anemia, eclampsia, bleeding, obstructed labor because their pelvis are undeveloped. They are also prone to STIs or sexually transmitted infection, especially if they have an older partner. If no contraceptives are provided, they may have rapid repeat pregnancies. Teens have shorter intervals between pregnancies compared to older women. Intimate partner violence is experienced by 13.6% of pregnant teenagers. Research has shown that postpartum depression may affect up to 50% of young mothers. Low self-esteem and feelings of loneliness are also common problems for young parents, especially for those who have limited social support. The infants of teen mothers are also at a disadvantage. They are at higher risk for prematurity, low birth weight, and are small for age, and may have severe neonatal complications. They are also at increased risk for psychosocial problems such as abuse, neglect, developmental delay, academic difficulties, behavioral disorders, substance use, and are also at higher risk for becoming teen mothers themselves. In some families, it seems it's intergenerational. Now, what are the factors that contribute to these complications? Tobacco use is associated with poor outcomes. Alcohol use can result in fetal alcohol spectrum disorder, and many adolescents don't realize they are pregnant and continue to use tobacco and alcohol. Poor nutrition is a major risk factor. 37% of pregnant adolescents are nutritionally at risk. Pregnancy demands an additional 400 to 500 calories, and if a teen is very young, there could be competition for nutrients because she's still growing. Poor maternal nutrition puts the young mother at risk for obstructed labor because the pelvis is undeveloped, and for her baby to be low birth weight. So malnourished mothers will have small babies, setting up an intergenerational cycle of malnutrition. Malnutrition stunts the body as well as the brain. Lower IQ means reduced school performance and lower capacity to earn. Thus, malnutrition has an economic cost. Teen pregnancy also has an economic cost, according to a study by Dr. Harin. If a pregnant adolescent drops out of school, she may earn only 46 pesos per day, compared to 361 pesos if she finishes school. She loses opportunities. And the country also loses an estimated 33 billion in potential income. So we see that teen pregnancy has profound medical, psychosocial, and economic costs. What can we do? There are two levels of prevention. The primary level is to prevent the first pregnancy, and this is through sexuality education, providing services, good parenting, and a change of attitude of the community. And the second level of prevention is preventing a second or subsequent pregnancy or rapid repeat pregnancy within 2 years. This is the purpose of the Teen Mom program that we are running at the PGH. It's a joint program between pediatrics and obstetrics. We offer comprehensive services, medical, obstetric, nutritional counseling, and psychosocial support. and child protection services when appropriate. What makes this unique is the use of the adolescent-friendly approach that is respectful, non-judgmental, and assures confidentiality. This is the outline of the obstetrical services that includes contraceptive services. We provide patient education on the following topics. And this is the module on infant care. We also emphasize the psychosocial aspect of care. Adolescent medicine does a psychosocial assessment using an interview format called HEADS that asks about education, has the patient dropped out, continued school, use of drugs, tobacco, alcohol, and other drugs, sexuality, including the question on abuse and intimate partner violence. We also screen for depression and risk for suicide. We do guided decision-making to help the adolescents figure out major issues. Will she raise the child with her family, with her partner? We always offer adoption as an option. Will she live with her parents or her partner? We discourage cohabitation. Will she drop out of school or continue school? We also point them to ALS, Alternative Learning System, or TESTA. We also ask if they plan to have another child, and they usually shake their heads vigorously. So we offer different contraceptive methods. We discuss the advantage of having a long-acting contraceptive method like IUD or Implanon that will offer protection for several years. Implanon, for instance, for 3 years. So that's enough time for her to breastfeed her baby, to recover, and to finish school. These are the key points of my talk. Teen pregnancy rates in the country is high with alarming rates among very young adolescents. We look at the factors that increase the risk for early pregnancy using the socio-ecological view. So no blaming the adolescent, please. I also described the medical, psychosocial impact on the young mother and her baby and the economic costs of teen pregnancy. Then I introduced the teen pregnancy program of PGH that offers comprehensive services in an adolescent-friendly approach. Finally, we believe that if providers succeed in creating a range of supports that respond to the needs of both young parents and their children, then teenage parenthood need not be a negative experience. Rather, it can become a catalyst for growth and positive outcomes. Thank you.
Thank you very much, Dr. Llanto. Indeed, the increasing rates of teenage pregnancy in our country is really alarming as it comes with a lot of risk, not only for the mother, but also for the baby. Thus, the more reason for us to be knowledgeable in handling this vulnerable age group. For our viewers, kindly save your questions for our Q&A sessions later because we'll have our second speaker to discuss more of the topic. Our second speaker is Dr. Maria Geraldine N. Castillo-Torralba. Dr. Torralba is an acclaimed alumna of the UP College of Medicine, class of 1997. She is currently a clinical associate professor in the Department of Obstetrics and Gynecology of the UP College of Medicine, and a training officer in the Division of Maternal Fetal Medicine of Philippine General Hospital's Department of Obstetrics and Gynecology. Dr. Torralba is also a fellow of many institutions, namely the Philippine Obstetrics and Gynecological Society, the Philippine Society of Maternal Fetal Medicine, and Philippine Society of Ultrasound in Obstetrics and Gynecology. She's now practicing as a consultant to many other institutions aside from PGH. She's affiliated in Manila Doctors Hospital and Alabang Medical Clinic System. Everyone, let's welcome Dr. Maria Geraldine N. Castillo-Torralba. Good afternoon, Ma'am Jack.
One of the most pressing issues that the Filipino youth are facing today is teenage pregnancy. The following are the objectives of my lecture. Teenage pregnancy or adolescent pregnancy is defined as pregnancy in females 19 years of age or younger. The Philippines has one of the highest adolescent birth rates among the ASEAN member states. Recent World Bank data shows that the Philippines has 47 births annually per 1,000 women aged 15 to 19 years old. And this is higher than the average adolescent birth rates of 44 globally and 33.5 in the ASEAN region. In a February 2021 article of the Philippine Star, the Commission on Population reported that births among girls aged 14 years and below jumped by 7% in 2019 compared with the previous year's figure provided by the Philippine Statistics Authority. In contrast, on March 2022, it has been reported that the 2 years' worth of lockdown had forced young Filipinos to stay at home, limiting social interactions with peers and inadvertently reducing opportunities for sexual encounters. From 495 births per day in 2019, the rate of births to teenage mothers actually decreased by 13% the following year during the pandemic in 2020. However, as the lockdown restrictions loosens and more Filipinos, the youths, are already vaccinated, medical experts worry that the effects will not last. Teen pregnancy is at increased risk for adverse maternal and neonatal outcomes. Whether these outcomes are the result of biological immaturity or socio-demographic factors related to adolescent pregnancy remains unclear. Adverse maternal outcomes as well as neonatal outcomes in teen moms have been confirmed in some but not all studies. A recent published 2022 article on maternal and neonatal complications in teen pregnancies and dislike comprised about approximately 661 patients. Results showed that there was an increased odds of several maternal complications such as hypertensive disorders of pregnancy, preterm birth, blood transfusion, as well as sexually transmitted infections. Conversely, teen pregnancies in this study were associated with the decreased odds of developing gestational diabetes, unplanned hysterectomy, and macrosomia or big baby. There were reported increased incidence of congenital birth defects in the neonate, low 5-minute Apgar score, neonatal sepsis or infection, as well as assisted ventilation. However, there were reportedly decreased incidence of low birth weight and NICU admission in the newborn. A 3-year retrospective study was conducted by one of our fellows, our graduates, Dr. Mary Jo Ibarra, in 2019 in the Division of Maternal Fetal Medicine in the Philippine General Hospital on the pregnancy outcomes among young premiparous patients, and I was her supervising investigator for this study. Results showed that overall, a common adverse outcome similar to the reported journals showed that there was an increased risk of pregnancy-related hypertension among the teen moms. Among the different age groups, it was noted that there was significantly more cases of cesarean delivery and thyroid-related disorders in patients younger than 14 years old. Neonatal outcome was overall good. In the Philippine General Hospital, we have the Teen Mom program. This is a joint activity of our division, Maternal and Fetal Medicine, of the Department of Obstetrics and Gynecology, as well as the Division of Adolescent Medicine of the Department of Pediatrics. Before the pandemic, it was conducted every Wednesday at the outpatient department of our hospital. What happens is that pregnant patients 18 years old and below, accompanied by their mothers or guardians, are scheduled every Wednesday. The teen moms are as much as possible seen in a separate room from all the other patients to give them privacy. Aside from the usual prenatal care or if there is a scheduled ultrasound needed for the patient, the teen moms have lectures as a group and are referred to the Division of Adolescent Medicine for psychosocial risk assessment. The teen mom usually register in the morning of Wednesdays and then proceed with lectures as a group with the following topics: Usually, the fellows of our division alternate with the pedi-adolescent fellows in conducting these lectures. By the end of March 2022, PGH was converted into a COVID-19 referral center, as we all know. With this conversion, infectious complications of pregnancy became the top medical complication being admitted in our department, and the outpatient department was closed for quite a time. As a result, there was a sharp decrease in teen moms who delivered in PGH who consulted at the teen mom clinic. Only 43 cases of adolescent pregnancy deliveries in PGH were seen in our OPD in 2020, a mere fraction of what we used to see in the previous years. We have noticed that during the pandemic, majority of the teen moms either do not seek hospital consult for prenatal care or opted to seek consult in their local health center or at lying-in clinics. For the age distribution of the teen moms in 2020, there were actually 2 patients who were as young as 14 years old. In the early part of 2021, we had the surge of COVID-19. The OPD again closed, and even when it opened, there was still limited face-to-face consultation. Even with continuous telehealth consultation, the census of the teen mom patients who delivered at PGH and were seen at the teen mom clinic further decreased in 2021. This is a comparison of the actual teenage patients who delivered in PGH during the pandemic and who had prenatal consult at our OPD. So in 2020, only 26% consulted at the outpatient department, either by telehealth or by face-to-face, which further decreased to 19% in 2021. Teenage pregnancy is, of course, a threat to the economic growth of the country. A United Nations Population Fund Commission study in 2016 revealed that those adolescents in the Philippines who have begun childbearing before the age of 18 are less likely to complete their secondary education compared to the adolescents who did not become pregnant. And of course, the non-completion of such secondary education has a great impact on their opportunities to become employed, and of course, also will have an effect on the life earnings of the families. Studies have shown that approximately 1/4 of adolescent mothers have a second child within 2 years of their first. Factors contributing to shorter birth intervals and multiple pregnancies in adolescents are as follows. What is also a shocking and worrisome reality are the cases of HIV among the youth. For the 48 reported cases in October 2021, in the adolescent age group of 10 to 19 years old, all cases were infected through sexual contact. So pregnancy has been recognized by the government as a national social emergency. In June 2021, President Duterte has signed an executive order adopting as a national priority the implementation of measures to prevent teenage pregnancy. And under Executive Order 141, the President directed all concerned government agencies to address the root causes of the growing problem. Root causes of the rising number of teenage pregnancies are a lack of reproductive health education, deep-seated norms that justify violence against women and children, engendered process, patterns of discrimination, and the vulnerability and exclusion of girls living in remote areas. Systematic reviews of prevention programs suggested that successful programs include a combination of interventions that provide comprehensive sexuality education, focus on the delay of sexual activity in teens, and promote consistent and correct use of effective contraceptive methods. To address the problem of the lack of reproductive health education, way back in 2012, the Responsible Parenthood and Reproductive Health Act included a provision that mandated the Department of Education to implement age and development appropriate comprehensive sexuality education in formal and non-formal education settings. By DepEd Order number 31, the comprehensive sexuality education was implemented to effectively address the needs of the learners for health and protection. This was integrated in the K-12 curriculum, and the comprehensive sexuality education standards were crafted to naturally blend with the competencies in the curriculum. However, in a 2021 Philippine Institute for Development study, it was reported that some teachers claimed that they did not receive any official communication about issues related to the comprehensive sexuality or the responsible parenthood and reproductive health education. They said that they may have been teaching some of these topics, but it was really not deliberately linked to the implementation of the law. When and how these were taught or integrated were upon the discretion of the teachers. To address these concerns, DepEd Order number 12 provided the adoption of the Basic Education Learning Continuity Plan for the school year of 2020-2021 in light of the COVID-19 public health emergency. DepEd conducted its pilot implementation of the comprehensive sexuality education in the field in the school year of 2020-2021. The pilot implementation coincided also with the implementation of the distance learning modality during the pandemic. The implementation in public schools was done in phases with selective divisions in schools in regions 1, 7, and 11, which were supposedly had the highest rate of teenage pregnancy. Accompanying the curriculum are DepEd teacher trainings in this field. The Adolescent Health Education and Practical Training, or ADEP, is a training from the Department of Health which aims to improve adolescent health care by bridging the communication gap between adolescents and healthcare service providers nationwide. Barriers to accessing comprehensive care are as follows. The United Nations Populations Fund, or the UNFPA, in its article on policy brief eliminating teenage pregnancy in the Philippines in January 2020, so this is prior to the pandemic, made several recommendations to reduce teenage pregnancy, and I would just like to discuss a few of these important recommendations. First is that we should increase adolescent and youth resilience and protection. There is no evidence that shows that sexuality education program would lead to early sexual debut or increased sexual activity. The comprehensive sexuality education has been recognized as the cornerstone of improving the sexual and reproductive health of our youth. To make healthy, responsible decisions, young people need accurate information about puberty, reproduction, relationships, the consequences of unsafe pregnancy like infection, as well as unintended pregnancy. Another recommendation would be to improve access to adolescent and youth-friendly services, including contraceptives. Privacy of our youth should be a priority. They are trained to appropriately respond to the needs of the adolescents and youth in a non-discriminatory, non-judgmental. They should be helpful, and it should definitely be in a confidential manner. Section 7 of the RPRH Act states that minors in the Philippines require written parental consent to access family planning services, including contraceptives. The only exception is for minors who have already given birth or had a previous miscarriage and abortion. Age of consent laws to access sexual and reproductive health services can discourage adolescents to fully exercise their sexual and reproductive rights. Even when adolescents and youth want to discuss sexuality and reproductive health issues with their parents, they tend to be unable to provide necessary information in an effective manner due to social cultural taboos and their own lack of knowledge. And therefore, the parents also need to be supported as well. Adolescents, girls' connectedness to parents, particularly to their mothers, and a family environment that supports gender equality contribute to delayed first sex among girls. Maximizing use of the media and communications for health promotion, of course, was another important recommendation. Increased access to the internet, social media, and new information technologies are platforms for interaction and knowledge sharing, especially among young people. However, we really have to be cautious about this since the Office of the Cybercrime of the Department of Justice reported a 264 increase of online sexual abuse and exploitation of children from March 1 to May 24, 2020. In summary, childbearing in adolescents carries increased risk for poor health outcomes for both the mother and the child, lower educational employment, and lower attainability of proper education, causing economic losses to the country. The comprehensive sexuality education alongside better access to services for the adolescent are the key to ending teenage pregnancy. And as the Commission on Population Region 2 Director Julita said, there should be no adolescent girl who will get pregnant early. They should be fulfilling their dreams, enjoying their adolescent years, and building their future. Thank you very much.
Thank you very much, Dr. Torralba. That was indeed a very comprehensive and high-yield talk. Today's talks made us more aware of the challenges that a female young adult faces during her pregnancy, but somehow it also gave us a glimpse of the challenges in the implementation of programs dedicated for the prevention of teenage pregnancy. So I know everyone in the audience is already excited to ask their questions to our speakers, but first let us hear from our esteemed reactor. Our reactor is an educational coach and a homeschooling advocate with a background in child development and education and special education from Miriam College and the University of the Philippines. As a homeschooling mom to 3 wonderful kids herself and a homeschooling advocate, she helps parents realize their important role in educating and building the character of their children via homeschooling and online distance learning. Everyone, let's all welcome Ms.Ina, Taningo, Taña. Good
Thank
afternoon,
you.
Ms.Ina.
Good afternoon, everyone. So first and foremost, the numbers are alarming. So we hear about this and we see pregnant teens walking around, but to see the actual numbers saddens me. So thank you, Dr. Torralba and Dr. Llanto for educating us on this topic. As a parent and educator, I always believe that everything starts from the home, and it starts with us parents. So how do we talk to our young children? If they point out to their genitals, do we call it a matter of factly or pa-cute or binabawalan ba natin silang sabihin ang totoong tawag? So when they ask something about sex or see a couple kissing, what do we say? Close your eyes. Bawal yan. So how we perceive sex also affects how our children look at their sexuality and sex in general. So we may answer their questions, of course, to the level that they will only understand. And as much as possible, walang mali siya. As per our esteemed speakers, we have laws on comprehensive sexuality education. However, there is no implementation. And all the laws pertain to educating our teens, but we forget about educating our parents. So becoming a parent isn't easy even as adults. So there's no manual for that. It's a big responsibility, but we don't even study that. So for teens, it's even more difficult as they have not finished developing themselves. Add to that is the shame that their own families and the society is making them feel. And that's a whole lot of burden to carry. So hats off to the Teen Mom program. So I'd like to think that it's never too late to change how we parent our own children. Sabi nga ni Dr. Torralba, adolescent girls' connectedness to parents, especially to mothers, play an important role in delaying the first sexual activity in girls. And so parents, let's not shame our own children for getting pregnant early. Instead, let's support and nurture them, teach them to dream, because as what Dr. Llanto has shared, the experience can become a catalyst for growth and positive life outcomes. And so with that, I would like to ask Dr. Llanto, just to start off our question and answer portion, is there also a support program for the parents of the teen moms in the Teen Mom program?
So the question is there also a support?
Yes, for the parents of the teen moms.
Yeah, okay. Although the focus really is on the adolescent who needs the support, we also talk to the mom because they also have their own concerns. And there are also issues that we have to take up with the moms, no? So of course we have to acknowledge also the grief, no, and the feeling of loss. You know, you have dreams, big dreams for your daughter, and she becomes pregnant. But we also want to reframe it that it's not the end of the world, no. And the thing that the mere fact that they are bringing their daughters to this clinic and seeking our services, that's really quite positive. So we also acknowledge their feeling of loss, and then we also support them and try to point them also to the resources within the hospital. So medical social services, we also have where they can get discounts and whatever community services that will be needed. So that's how we support our parents.
Thank you.
You're right, Ma'am Ina, no? It's not only a challenge to the adolescent mom, pero parang second parenthood for the moms of the adolescent mom, nagiging extended family. Anyway, to our audience, for your questions, you may type in your questions in the Q&A boxes of the UP Manila live stream and Zoom, and then the chat boxes of Facebook Live and YouTube. We already have one question. What age should you start discussing sex to a child? Doc Emma?
Well, as Ms.Ina said, it starts very young, and as early as as a child, naming the genitals correctly. It's a penis, it's a vagina, and these parts of your body are private. Nobody can touch these parts. So we start really early, and it has to be developmentally appropriate, no? So teaching, for instance, about pregnancy or sexuality or STI in high school, that's too late. Remember, these children are exposed to sex every single day in advertisements, in music, in TikTok, it's everywhere. But we refuse to talk to them about it, no? So that's a big topic. But start early, and it has to be developmentally appropriate. And what is really effective is really a school-based sexuality education, and it's comprehensive. The reason why it's school-based, it's because you can't really expect the parents to be an expert on this. No, you need some training. And number two is that's where the kids are, school. The second is that the second reason is that it's not like a one-time lecture. It's like progressively, as they become older, age appropriate siya. So it takes time to give and administer, and it's not only lectures, kasi it's also skills building, no? Skills building in terms of decision making, on saying no, in negotiating, in asking for help from adults, mga ganyan. So it's not like just teaching them contraception or condoms. No, it's really skills building, inclusiveness. So that's why it's called comprehensive, and it's best administered in school because of the reasons I mentioned. But parents, sana should take a more active role in it, and just be, change the culture of shame about talking about sexuality. That's part of our personhood. And that's what is keeping us from talking about this very important topic. I'll stop here.
I think it's really difficult, ma'am, because it's ingrained in our culture, yung pagiging conservative. diba? Ms.Ina, I'm interested because you're a homeschooling advocate. So, how do you, and you have your 3 kids. Were you able to discuss about sexual health with your kids already?
Yes, and they are free to ask me any questions. One time, my 14-year-old daughter just asked me, we were driving, and she said, how do you not get pregnant? So I was so shocked, but I was able to respond without any malice. And I just said, well, the sure way is not to do it, but there are ways that, should that happen already. So I discussed it, but in a way that, she can understand at her level. But prior to that, because I do as a homeschooler, I also get materials from abroad. So I don't just use our local materials. So I look for ways like there's the reproductive health, and there's also safety. So yung safety everywhere yon, safety in the home, safety sa body, lahat yon. So ang sa akin lang isa ko natutunan, no, sa school sinasabi yan eh. Kaya lang kasi hindi open sa pamilya. So kung hindi pa rin siya open sa pamilya, parang hindi naman siya worthless, na nadidiscuss sa school. Kaya lang kung hindi open ang bata sa magulang, mahirap din. Kasi magtatanong din siya sa mga kaibigan na hindi rin masyadong alam. 'Di ba? So siguro dun lang I think I really believe that openness in the home has to plays a big role, no? I can go on and on, so I will stop here also.
Because I was just interested when you said, diba, we call the sex organs different things during childhood. And it's really quite challenging, especially ako, meron din akong pamangkin. And then she was listening to one of our webinars about the myths and facts of getting pregnant. Sabi, mabubuntis ka ba kapag isang beses mo lang ginawa? So, parang, tita, pwede palang mabuntis. So parang I was really shocked. At 9 years old, she was already asking about these things. And she already knows because she's been watching Netflix and social media. So somehow, ma'am, you think if there are parents who are interested in opening these discussions, is there a place where they could call or a hotline where they could be guided?
Unfortunately, wala tayong ganung program, but we can start, we can start something.
Ina, we can start a business.
Yes. Of course, but we can start something.
To those mothers So parang they don't know also where to get that information. Chances are they would consult Dr. Google and then find something on the internet.
Exactly. At saka nahihiya din sila kasi mismo. Hindi ba? Kaya si Dr. Google na lang.
But at the same time, we also have to acknowledge that there are really good sites, di ba, Ms.Ina?
Yes, I agree.
For my patients, when they're like 7 or 8, I already tell the parents, girls can enter adolescence, can enter puberty by 8 years old. So breast development. I point them to certain websites. I can just type here. They can go and study. There's you call it kidshealth.org, and there's a version for parents, there's a version for children, and version for teenagers. So it's the same message, but it's given in an age appropriate. So I tell them study first, and then go online with your daughter, and so that's helpful because it is awkward. I mean, I remember my daughter asking me, "Mom, what's oral sex?" So, and she said, Isn't that sex that you talk about only? Oral sex. So parang she's a doctor now, so I won't mention her. So
I think I know her, Doktora.
I know her, but it just really alerted me to the fact that they hear these words, and you are in a position to really give them the correct information, and don't waste that opportunity or teachable moments. As Ms.Ina said, you see these two people kissing on TV, or somebody gets pregnant in the neighborhood. Use that teachable moment, because and that's the start of a conversation, because it's not just one conversation, it's like a whole set of conversation that you continue.
Yeah, so there's a comment from our audience. I think there should be projects like this to every LGU to educate parents and children on this kind of topics. Yes, we're already working on it po. This is actually a preview of what's in store for us for the next year. The Dr. Llanto will also be working with us, Doktora, to develop all these topics because it's not enough. Now, 30 minutes to an hour is not enough. Anyway, Dr. Torralba, you mentioned about complications in teenage pregnancy. Can you give the members of the audience parang key pointers? What should these teenagers look out, no, about their own health first? So the mother's health.
Okay, Gladdy, thank you for that question. Okay, so what is important is that when the patient, because sometimes many of these patients have irregular menses, so the teen moms, they actually are not sure. They just think that they just miss their menses as what they're used to. Okay, so first is there should be a high index of suspicion. Okay, when your daughter doesn't have her menses, okay, that you have and is sexually active. So you have to be when you're sexually active, you have to know, you have to do a pregnancy test, establish it early so that you can go for consult for prenatal care early on. Okay, and so and then we emphasize this the way like in the teen mom clinic when we had it pre-pandemic, they should go regularly for checkup because as we all know, premiparity is a very high risk factor for developing hypertension during pregnancy. That's why in the studies that I've mentioned, what is prominent or majority of the complication will be related to hypertension. So they should have adequate prenatal care so that they can plan their delivery. And also, of course, until postpartum, after delivery, sometimes these patients, the teen moms, they're so busy already taking care of their babies. Okay, so what actually prior to sending them home, Gladdy, di ba, we already advised them about contraception. Okay, actually now since we have the implant, okay, before discharging the patients is already an option with about inserting the implant so that they are sure that they will have the contraception already. Thank you, Gladdy.
Thank you, Ma'am Je. So for teenagers, I think you should be very you should know yung last menstrual period. Guilty ako dyan, ma'am, actually. Even me, sometimes I don't record my menstrual period. Wait na lang ako ng ibang OB. But I guess it's very important, no, not only for teenagers. And then, second, for the parents, we usually see these teenagers being brought to the emergency room. Sometimes they present with vaginal spotting. Tapos even the moms, Ma'am Jo, diba, they usually, inaaway nila kami minsan sa emergency room whenever we request for a pregnancy test. So, just for the knowledge of everyone, no, any patient who's in the reproductive age and who's presenting with vaginal bleeding, OBs like us always request for a pregnancy test because we want to rule that possibility out. Huwag po kayong magagalit sa amin. It's part of our protocol.
Yes, Gladdy, hindi pwedeng sinabi lang na not active because, you know, a lot of the patients naman, they don't want to disclose sexual activity to their parents, lalo na in our society. Kasi nga when I'm reading online, doon ko na-realize tayo kasi when we say dating tayo, going out, watching movies, abroad yung dating talagang part, if you're dating someone na steady kayo, sexual activity is really part of it already. So iba-iba yung definition diba? Okay.
Opo. Dating. Doc Llanto, you've already managed a lot of teenage moms. So what are their usual concerns po? I mean, something that they couldn't tell their parents.
Yeah.
How should we as healthcare workers deal with this?
Okay. So, yung I was wondering kasi initially, ano ba yung early dating? Well, abroad they define it as dating below 16 years old. Um, so that's how they define it. And I guess ako, if I were a mom, sana we'd wait until 18 years old, no? Because they are, we hope that by the time they already have better decision making. By the way, the adolescent brain is not fully developed until 24 or 25. So, adolescents are prone to poor planning, can't really imagine consequences, may not be able to, negotiate or think of alternatives, no, because the brain is still in the process of developing. That's when parents and doctors come in. This is the time when we teach them the skills to decide and to discern. And the other thing is that it's like we're putting all the burden on the girls, no? But it's really the data we presented, Doktora Torralba, most of the fathers, no, especially for 14 to 19 year old, below 15 years old, 90% are older. So if I were a parent, really, if somebody's gonna court my daughter and 4 years older, I'd be very, very worried and not discourage her from doing that, because the older the partner, mas ma-coerce at saka mas ma-force, no? And it's not only like being threatened with violence, but it's sweet talking, it's being makukulit. These are also forms of coercion, no? And also at the same time, giving gifts, paying expenses for the family, that's also a form of coercion. So the question here, what was your question? Sorry, I got lost.
And what are the common concerns that a teenage mom asks you sa clinics? Yung something that they can't tell their parents.
Yeah. One of the first things that we deal with is really the disclosure. Especially they come in early and they just suspect that they're pregnant. So it's really the disclosure to the parents, which is a big issue. And so we try to also assist them in the disclosure. When they come to the clinic, diba, Doktora Torralba, things have kind of simmered down. The parents have know about the pregnancy. They know about the pregnancy, and they're there to access health care. What is usually the concern of the adolescents that I don't want to stop going to school. I want to continue schooling. So that's always like that. That really also touches my heart, because I don't want. I want to continue and be, become a teacher, ganyan, and then so we assure them that they have the right to continue. They can't be kicked out of school. No, that's their right to continue. And we also talk to the parents about the contraception, as Dr. Torralba said. We talk about it early, because that gives them time. If they have another pregnancy in another 2 years, walang mangyari, And so yon, and also we talk to the grandparents about childcare, that they support their adolescents in childcare, because that's the only way the adolescent can go back to school. So it's a big issue with them being able to go back to school. Yon. And sometimes they also are able to disclose to us intimate partner violence or abuse from their partners that they're too ashamed to tell to the parents. So we also assist them in the disclosure and a referral. So basically those are the two main issues that we see.
Basically, ma'am, disclosure that they're already pregnant.
Yeah.
And then disclosure how they get pregnant. Yes. Anyway, I had one experience before, ma'am, that as you said, these teenagers, they want to continue with school, but there is an institution that somehow discriminates these teenage moms. What can they do about this? Paano kung gustong-gusto talaga nilang pumasok, but the institution doesn't want to admit them?
There's actually if you want to be legalistic about it, there's an anti-discrimination law. It's Magna Carta for women. It says that you cannot be discriminated on in terms of getting education, etc., because of your marital status or because you got pregnant. That's against the law. So we encourage them to still continue if that's really, sometimes kasi they get discouraged because they're too embarrassed. So if they think that they can't go to school, the regular school, we point them to ALS. That's an alternative learning system of DepEd. So that's available also, no? And I don't know homeschooling, but that's going to be an entirely different proposition. And that they have the right, they can't be kicked out. There's a law against that. That's discrimination talaga.
Gladdy, Glads?
Yes, Dr.
I just want to add, okay, actually, it's a good thing that the parents or the patients that you have encountered are really very aggressive and they want to continue their education. But actually, on my part, I've had a lot of parents who are quite ashamed, di ba, na if their kids will still continue going to school. So early on, or even the teenager herself, kasi there will always be discrimination, and then if she stops, tapos late na siya, she'll go back to that same school. Of course, people will ask why she's late. Okay, so but I want to emphasize that when we have teen moms, very important, even while at the start of their antenatal care, part yung counseling about education. And I always tell them about studies that those, because teen pregnancy is a reality. So sexual activity is really part of a relationship, lalo na at the current time, di na natin mababago yan compared dun sa upbringing natin before. So I emphasize to them that those who become pregnant during their teenage years, they can still have a very bright future if they complete their education. Okay? So swerte naman ako for me, some of the teenage moms I handled, they delivered during Christmas break. So, or summer break. So, hindi sila nagsastop sa school. Tapos, I also emphasize to them, even if you miss classes, and we'll just make a certificate that you can submit or take the exams that you missed. So, it's part really to emphasize education, aside from emphasizing also contraception to prevent future pregnancies. Kasi pag tinanong mo yan, hindi na ho, doktora, pero babalik na naman. 'Di ba? Kaya we have dun sa teen moms, 'di ba, na census na pinakita, marami, there are about a fraction that second pregnancy na nila. Okay. Thank you, Glads.
Thank you, ma'am. So education is very important even if you're already a mom. So our options are fight for your right for the education. So you're legally protected by discrimination. Second, you have ALS as an option. And third, you can opt to have homeschooling. Ms.Ina, for those interested with homeschooling, can you give us an advice on how we can connect with you or connect with institutions that offer homeschooling?
Well, there's a lot of providers out there. There's Catholic Filipino Academy, there's Seton, there's Homeschool Global. So you can all Google that. There's a homeschooling community in Facebook. So you can also log in and join, even if you're not yet a homeschooler. So you just want to learn. But I would just say that to each his own. Hindi po ba? Kasi hindi po lahat para sa homeschooling, hindi rin po lahat pang traditional. So I would always go for what is your family's objective. Hindi po ba? So, yun lang. So, that's it.
Okay. Thank you, Ms.Ina. Grabe, it's already 1 p.m. I know there are a lot of questions, but let me just entertain our last two questions. So we have from our chat box, is parents or guardians' consent mandatory in managing adolescent, especially during emergency cases, like for example, a ruptured ectopic pregnancy, very particular. Doc Jack?
Yes, we have to have the parents' consent Okay, di ba? When for the minors, those less than 18 years old. But sometimes kasi it's not the parents they are with, it's just their boyfriends, di ba? So, well, we try to we inform the patient, di ba, Glads, that we have to at least a relative, if not the parents, to go to the hospital. But of course, it's an emergency, so we have to proceed even without the consent. But as much as possible, uh, even I mean, we have to make the effort to contact the parents, the guardians, or any family member.
Yes. So the parents or guardians' consent is mandatory.
Yes.
However, in emergency cases, I think we have a hospital protocol. So each hospital has a protocol on who to call and whom to refer the cases to. Right, Dr.
Yes.
Yeah. So in relation to this, in terms of getting contraception, is the parents or guardians' consent also necessary? Doc Llanto?
Unfortunately, our RPRH law, the reproductive health law, is very restrictive when it comes to granting of contraceptive services to our patients. No, so it states there that you should get the parental consent, which is really silly. I mean, why? Who on earth would go to your parent, Mom, can I get your written consent for the use of this contraceptive? But anyway, it's there. But the thing is that there's no penalty. And no, ang ano natin dito is that I still go back to the best interest of the child. If I really believe that this child will benefit from using contraceptives, even without parental consent, I would probably do that. In our hospital, Doktora, Doc Jem, we do ask consent when we insert an IUD and an implanon. Is that right? We do get the consent. We still do get the consent, but I really feel that the current laws are restrictive. However, you can always teach the adolescent how to use a condom. You can always point them to where you can get condoms, and you won't be penalized or anything. So whenever you can, please, number one, the first message, Karen, by the way, is not to have sex. That's abstinence. The second is, but you don't stop with just talking about abstinence. You also talk about, as Ms.Ina said, you also talk about protecting yourself and your partner if we ever come to that decision. And hopefully you have also the skills to make that decision. And so as health providers, please always, our adolescents have the right to accurate information. So whenever you have the chance and you ever have the opportunity, please talk to them straight about matters like this. You may be the only adult who will address them in this way, and teach them how to use a condom properly, and they can use it and they can access without prescription naman. So that's my stand, and I think that law should be relaxed or amended or something. How do you do that?
From this from this forum alone, we realize that there's a lot that needs to be done. Anyway, to wrap things up, may we ask for a few points that you want our viewers to remember from this forum? Ms.Ina, the key pointers from this forum, may we ask from you?
I think really it's education. So what Dr. Llanto and Dr. Torralba has given us is they are educating us on teenage pregnancy, and not just on the, how do I say it? Not just on what medical, on the medical side of it, but also like how we should take care of our teens emotionally, and not to shame them. So the bottom line of all of this is really education. So educating our parents, our teen moms, educating everybody on how to be caring, to be a caring community, to be an inclusive community.
Thank you, Ms.Ina. Dr. Torralba?
Glad to, for me, I just want everyone to remember that as what our Ma'am-Ina has mentioned, the cornerstone, the key to prevention is really education. We have to educate the teen moms. We have to educate their parents. We have to educate also the boyfriends, the partner, malaking factor yun. So education, and also we have to have more information about contraception to prevent another pregnancy.
Education and contraception. Dr. Llanto?
Yeah, so it's education plus the health services should be available. And the other thing is that once they come in for pregnancy, we do an excellent job on giving them obstetric care, but we should also couple it with psychosocial support, because it's just as important as the medical care, because they need support more than any time in the, this is the time when they really need the support of the parents, and rejecting your child when she gets pregnant is really not the best for that child and your apo. So a good teen pregnancy program takes care both of the medical and the psychosocial aspect of care. And I hope that we can replicate this program, and we need to reestablish it, by the way, in PGH, face-to-face.
Yes, Pop.
Thank you.
Okay, so we have education, contraception, and an institution that will provide support for all of our teen mothers and their child, as well as the moms of the teen moms, as we learn from this forum. It's good to know, though, that the Mu Sigma Phi sorority has a project called Teenage Education for an Empowered Nation. So we do have face-to-face discussions and webinars that we've been doing for several years now, and we hope that we could enjoin our present speakers, our reactor, and our audience to help us push through with our mission of providing education to the community, especially the teenagers. So we're expecting you for the coming year to be with us for our future webinars. Okay, so thank you again to our speakers and to our audience. Just before we officially end, we, the Mu webinar team of the Mu Sigma Phi Medical Sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, the City of Manila. This event would not also be possible without our co-presenters, In-Life Heroes, and the Mu Sigma Phi Foundation. Of course, our official media partner, our awesome planet. We are also grateful for the unwavering support of UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us for the past months. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form provided. So you may find the links to the evaluation forms at the comment boxes of Facebook Live, YouTube, and chat box of Zoom. The past year has been a fruitful discussion with all of you. So from July to up to now, we thank everyone for joining us and for supporting our webinar series. We hope that you have learned a lot from this fora. We are hoping to see you again soon, everyone. Thank you very much and have a good day.
Thank you.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The Mu webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In-Life Heroes, and the Mu Sigma Phi Foundation.
And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store.
Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at muwebinars2122@gmail.com.
This wraps up the year-long Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum series. Thank you very much for attending the webinar series. We hope to see you again someday. Have a great day.